Okay, I'm here. I'm going to be doing an peripheral IV today, so I will review the physician order first, and then I'm going to patient's room. Hi, my name is Zahi. I'll be your nurse today, so I have an order to do an IV for you. Okay, and before I get started, so I'll give the patient the privacy, and I will do hand hygiene. Okay, so before we get started, can you please say your full name and your date of birth? Do you have any allergies? No allergy to chlorhexidine? Okay, so I'm going to be inserting the IV, which is the tube that's going to go to your vein, and it can be used for the IV medication or for IV fluid. Okay, do you have any question? No? Okay, so I'm gonna gather the supplies. So I have my supplies, I have the towel, gloves, and the IV start kit with the tourniquet and the transparent dressing, and I have the IV extension set, IV catheter, and normal saline, 10 ml of normal saline. Okay, after gathering my supplies, so I'm going to apply the tourniquet. So I will apply the tourniquet under the upper arm. Okay. So apply tourniquet to the upper arm to choose the appropriate vein. Okay. So I'm gonna go with this vein. Okay, and I will release the tourniquet. Okay, next I'm going to prepare my equipment. So I'm going to prime the end cap of the extension. So the end cap is the extension set with normal saline, and we just make sure the end cap, I will just keep it sterile. Okay, we lose the end part here, and we do some flush to make sure that the fluid go through. Okay, just lose it more. Okay, did flush. Okay, I'll just keep it sterile here. Okay, next I have my IV catheter, so I just gonna open it partially to have it ready for me. Okay, the IV catheter, and I will have my thing, the chloroprep cloth and the transparent dressing. Okay, next I'm going to apply towel under the forearm. So I'm going to apply towel under the forearm here. Okay, next I'm gonna do hand hygiene. And put on clean gloves. Okay, and next I'm going to clean. So I'm going to clean the area with chlorhexidine in up and down scrubbing motion, and we'll cover 2 to 3 inches of the area that cover with transparent dressing, and I will let it dry for 30 seconds. And if the patient is allergic to chlorhexidine, I will use alcohol for 30 seconds in circular motion outward. Okay, next I'm going, after the area dries, so I'm going to reapply the tourniquet. Okay, reapply tourniquet. I'm going to open the IV catheter. Make sure I don't touch the open part of it. So I will inspect the catheter for any flaws. I don't see flaws, so I'm going to apply the pressure to the vein and I'm going to insert the catheter. Okay, Mr. Smith, so I'm going to insert the catheter. Just take a deep breath, you will feel stick. So apply the catheter. Okay, and I will inspect for blood flush. Okay, and next I will release the catheter of the needle up to half. Okay, and then I will release the tourniquet. Okay, next I will stabilize the catheter here and apply pressure to the vein, and I will release the needle and quickly, so needle go to the sharp container. So I will quickly attach the extension set to the catheter and make sure that I don't touch the open end of the catheter. Okay. Okay, I will flush, aspirate for blood first. So I will aspirate for blood, so I see blood, and next I will flush of minimum to 3 ml of normal saline to the vein. Okay, and next I will watch for the swelling or pain. No swelling or pain, so just stabilize the catheter and we'll apply transparent dressing. Okay. Okay, now for pain or swelling, so I'm just going to remove the saline syringe. So remove the syringe, and I will close the clamp. Okay, and next I will label the side with a needle gauge. So I use 22 needle, and the date and the time, initial, and the signature and my initials. So I'm going to label it. Okay, I'm going to instruct the patient. So Mr. Smith, if you experience any redness, pain, swelling, drainage, please let us know so we can take a look at it. And only one IV attempt, and so I will document the procedure. So the insertion side was the right 40 arm, and patient tolerate the procedure, and 22 gauge was used. So next I will clean the area here. Okay, so clean everything. Take the gloves off and do hand hygiene. Just take the tourniquet, apply hand hygiene, and here's your call line. If you need anything, let us know. Thank you.